Why cardiac surgery? What was your moment where you decided that you want to be a cardiac surgeon?
Well, I will trace that answer back to my school days. Only option I had to become was a cardiac surgeon.
Okay. That moment, like, that really struck you. Remember, what was it?
Because of a massive heart attack, a portion of his heart wall has ruptured. Blood pressures were around in the range of 70, 80, and that is quite inadequate for a 37 years old adult. So we established the circulation, putting the patient on cardiopulmonary bypass. Well, it took us around 15 to 16 days, but finally the patient was able to stand on his feet and go home with his wife and the 6 years old kid.
How does it feel? How does it feel to have, the power, that superpower to save actually someone's life in that?
It's not my power or not my superpower. It's like we have been trained to do so and saving every patient. And it's ultimately the divine power which helps us. We have seen many old patients, even up to age of 85, 90 years, going home even after very complex surgeries, staying for 5 to 15 days in the hospital. And we have lost patients even young as 20.
Why India? Why? Like often in cardiac surgery, the outcomes are not what you would have wanted. How does that take a toll on your mental health?
It's quite disheartening. And yes, it actually stays with us till we see the next smile.
So welcome to our first podcast. A very warm welcome to Dr. Anupam Das, who is a consultant cardiac surgeon in Sarvodaya Hospital, Faridabad. A very warm welcome to you, sir, on our podcast.
Thank you very much.
So, like cardiac surgery, sir, like one of the most complex surgeries after neurosurgery, I guess, if I'm right. Why cardiac surgery? What was your moment where you decided that you want to be a cardiac surgeon?
Well, I will trace that answer back to my school days. My grandfather was I was actually very beloved of my grandfather, and he showed me the dream to become a doctor around, I think, class 6th or 7th. And by the time I started reading biology in maybe 9th and 10th standard, I was fascinated with the anatomy of the heart and how it functions. So one thing was definitely decided that yes, I need to be a doctor, something related to heart. And gradually over the next 2 or 3 years, maybe by the end of my schooling, I decided to be a surgeon. So the only option I had to become was a cardiac surgeon.
Okay. That is a pretty brilliant answer. Yeah, so you have been in cardiac surgery for past
15
surgery.
years.
Yeah, 15 years. Surgery has been your passion. So one moment like that really struck you, that still stays with you, you still remember. What was it?
Well, it's not very distant past. It's actually within the last 5 or 6 months. I was working in a setup. It was Sunday early morning, and Sundays are usually lazy for me. But 7:30 in the morning, I got a phone call from our cardiologist fellow that a 37 years guy was admitted 2 days back with history of chest pain, and they had planned angiography for him to rule out atherosclerotic coronary artery disease. But because he was stable, they thought it to be postponed to the next day. But that day, he had a sudden fall in the blood pressure. He became unconscious, and they did an echo. And what they found was because of a massive heart attack, a portion of his heart wall has ruptured. So there was no option for us for any angiography or anything. We needed just to go in and do something. So I rushed my team. By the time we reached, the patient's relatives had already been counseled regarding the risk of the surgery and what was the condition of the patient currently. We took him into the OR. The anesthesia team was there. By the time they actually gave the anesthesia, we opened up the chest and immediately put him on cardiopulmonary bypass to support the heart so that we can actually re-establish the circulation in the heart. By that time, the blood pressures were around in the range of 70, 80, and that is quite inadequate for a 37 years old adult. So we established the circulation, putting the patient on cardiopulmonary bypass, which in common people we use the term as heart-lung machine. And after we arrested the heart, we repaired the wall of the heart with multiple patches. We did the bypass of 2 or 3 vessels as well, and the patient was shifted to the ICU. Well, it took us around 15 to 16 days, but
That's
finally
massive.
the patient was able to stand on his feet and go home with his wife and the 6 years old kid. It was a sort of a blessing for us, and it was a sort of a miracle for us, because to mobilize an entire team to reach the cardiology department and to take in the patient into OR and do such a massive complex surgery, and then the patient when goes home happily, was a very delightful picture for all of us. So I still remember that event, because even a single delay of a minute or so would
Minutes.
have actually affected the outcome of the surgery and the later on the family as well.
Oh, okay. That was very emotional. So, like, how does it feel? How does it feel to have, the power, that superpower to save actually someone's life in that critical moment when, actually the chances are pretty low, but still something good comes out of it. What do you feel in that moment?
Neha, I would say that it's not my power or not my superpower. It's like we have been trained to do so. And saving lives is not in our hand. We give our best, whatever we have been taught, whatever we have experienced in our careers, in our surgeries, we try in every patient. And it's ultimately the divine power which helps us. We have seen many old patients, even up to age of 85, 90 years, going home even after very complex surgeries, staying for 5 to 15 days in the hospital. And we have lost patients even young as 20 years, 21 years after getting simple surgeries as well. So, in every patient, we gave our best, but the outcome is finally decided by both the patient's preoperative condition, and, of course, the divine power has the last say in it.
So, sir, you have like multiple accreditation across the globe. You are the member of American College of Surgeons. You have FRCS, and you are also a member of European Board of Surgeons. But why India? Why? You could have practiced anywhere across the globe. Why you chose to come back and to practice in India? What drives you?
Well, to start with, I would say that since I am an Indian, so I had to practice in India. It's not that after getting so much fellowships and memberships, I didn't communicate with my foreign colleagues and all. But what I've found is that the complexity, the challenges in every case, the anatomy and everything we found in India is quite different from those Western countries and all. I have recently interacted with a Spanish team from Barcelona regarding surgeries in babies with tetralogy of Fallot. They visited us. We combined operated around 9 to 10 cases in a week, and all the kids went home. But they were actually astonished to see the complexities of the surgery. And it is his statement that we never found such complex anatomies in the heart. They operate the same subset, but quite different and quite easier than what we found in India. So it has been always challenging, and since cardiac surgery has been my passion since the beginning, so that's why probably it's better to practice in India among my own people, and also to benefit my own motherland from where I have actually learnt everything, to benefit my professors who have actually taught me so many things. So practice. Having been trained in India and practicing outside doesn't seem the right way.
Okay. Thank you for putting it out so well. And sir, like when the outcomes, like often in cardiac surgery, the outcomes are not what you would have wanted. How does that take a toll on your mental health?
It's quite disheartening. And yes, it actually stays with us till we see the next smile. When we lose a patient, it's actually demoralizing for the entire team. And being the leader of the team, yes, it affects me a lot. Even I keep on thinking about where I went wrong or what we could have done differently to save this life. So sometimes, having said so, there are many situations where we could not have done anything differently, and the patient's condition, the patient's disease, everything that affects the outcome. So finally it has to be, we have to, and particularly may I have to explain myself, no, you gave it everything to that, but still the outcome was not good. But it happens many times, but we have to move on.
In your career, if I ask you the one biggest blessing that you feel in your life?
Previously, I was working in AIMS Jodhpur, and to start with, when I joined there, the area of Western Rajasthan, there were so many kids with congenital heart diseases, and these patients were belonging to lower socioeconomic strata, and they could not go to centers where congenital heart surgeons would be there. So they were either being neglected because of lack of financial support, or they were not actually being getting diagnosed. I was fortunate enough being supported by the administration of AIMS Jodhpur to start with this congenital heart surgery program. And gradually I realized that the number of kids I was getting operating upon, they started to increasing, and I started to develop a personal relationship with these parents. Till now I have received so many videos of these kids getting
Oh.
yeah, more older and older. They, from infancy they have grown to 3 to 4 years toddler age group and all, and it is always heartening to see these kids doing so well. Recently, a kid I operated in AIMS Jodhpur previously, the kid visited me in Sarvodaya Hospital. The parents were quite emphasizing, ki, sir, I want to visit you only. So I told them, ki, you come here. So they visited me from Ganganagar.
They
And
visited you here.
yeah, they
They
visited
came
me
all the
from
way from
Ganganagar.
there.
Yeah,
Okay.
and the mother told me this 4 or 5 years old child who was operated upon because of a hole in the heart. The girl was so excited कि मुझे अनुपम सर से ही मिलना है, अनुपम सर से ही मिलना है. And when she was here, she was all smiling and shying away. So it looks actually, it seems to be blessing only to see these kids smile. And not only kids, when the adults also get operated upon, they come back hearty and healthy, saying कि साहब अब कोई दिक्कत नहीं है, अब बिल्कुल बढ़िया है, हम सब काम कर लेते हैं. तो it's actually a very good feeling.
What is like your biggest fear in the OR?
So my biggest fear is, for me, it's not a patient. I am operating upon thousands of patients, but that patient belongs to a family. That may be a mother or father of a child. That may be a brother of a sister. That may be the kid or only kid of the parents.
Yeah.
And sometimes these are precious pregnancies. So the pressure is to actually make them fine, make them healthy, do the surgery, and just the way they came walking up to us, they should go back to their parents or their own relatives just happy and healthy back.
So, sir, there is still a lot of stigma around cardiac surgery. Like, people will go to any level just to avoid cardiac surgery. So, what is your message to people who are still reluctant not to go through the surgery?
See, when actually what the history of our cardiac surgery teaches is that when it began, it was actually complex. We have traveled many years since then, and now it's not that much difficult from the surgical point of view and as well as from the patient's point of view. Many complex surgeries are being done with minimal risk and with advanced technologies, with minimal incisions, minimal pain. And these patients do recover and go back to their work and home by 15 to 20 days of time duration following the surgery. So I would just suggest to the people who are actually fearing from cardiac surgeries, but they need that thing as a treatment of their ailment, that they should talk to their surgeons and should come forward to get these surgeries done at the right time. The more delay they make, the worse the outcome becomes. So earliest the diagnosis is made, the earliest the surgery should be done. And yes, these surgeries are now done with advanced technologies with even minimal incisions. So yes, the recovery is quite faster.
So much, sir. With that,